Introducing a new approach to veterinary medicine, fluorescent light energy. Fluorescence biomodulation is a new technology to manage impaired and damaged skin by delivering fluorescence at a cellular and molecular level. Also known as light therapy, it uses controlled artificial light to help reduce symptoms of a range of skin and soft tissue conditions. Different light wavelengths penetrate to different layers of the skin, giving a key advantage of a polychromatic light over single-frequency sources. Blue light targets bacteria and has anti-inflammatory effects in the epidermis. Green light targets fibroblasts in the dermis, accelerating healing processes. Yellow light reduces inflammatory signs such as redness and swelling by targeting blood vessels in the dermis. Red light targets vascular and inflamed tissue in the dermis and upper hypodermis, reducing inflammation and increasing collagen synthesis. Unlike monochromatic light sources, which can only target one tissue type, fluorescence biomodulation is a new technique to expose the skin to polychromatic fluorescent light energy, targeting multiple layers simultaneously. A multi-LED lamp provides the initial light energy, and it's converted into fluorescent light energy by the gel. There are many photoacceptors within living cells that can be stimulated by appropriate wavelengths of fluorescent light energy. Photobiomodulation stimulates mitochondrial activity. Application of the proper wavelengths of light energy triggers a cascade of molecular reactions, stimulating the healing process. Accelerated regeneration, accelerated angiogenesis, and dermal regeneration. This is how fluorescence biomodulation helps manage skin problems at the cellular level, helping pets and their owners. Vedakino, achieve more together. Fovea is a new approach to managing pet skin problems, using polychromatic light energy to target multiple layers of the skin simultaneously. So let's see just how easy it is to use in your day-to-day work. The Fovea system for managing skin problems consists of two elements, the lamp and the chromophore gel. The unique component of Fovea is the chromatophore gel. To prepare it for use, mix the supplied ampule of chromatophores with the carrier gel. Then give it a good stir. The next bit is even easier, at least with a well-behaved pet. Apply it evenly over affected skin areas. Make sure everyone's wearing the supplied goggles. Then use the charge lamp to light up the gel where it lies on his skin. This will activate the chromophores on the skin's surface, releasing a flood of fluorescent light energy into the tissues. When you press the start button, the lamp will make a beep. Keep the lamp as close as possible to the skin. Each cycle lasts 2 minutes, and there is a timer built into the lamp. After 2 minutes, you will hear another beep to signal that the treatment cycle is complete, and the lamp will shut off automatically. Use a saline-soaked swab to remove the gel, so he's ready to go home. It really is that quick and easy. Gel on, lamp on, wipe off. Fovea, a new quick and easy option for you to help pets and their owners manage skin problems. Vedakino, achieve more together.
Fovea in wounds has a very positive effect. As I mentioned, it has not only antibacterial activity, it promotes that balanced wound healing. And so that balanced wound healing, when we start to look at it, basically gets us to a point where we can actually see less scar tissue, we can see normal skin, and where we need those is in areas that have that kind of greatest flexibility. So areas like the elbows or areas like the hocks where you're seeing a lot of movement there. Because in those areas it's very difficult, even, I bet you if you talk to a surgeon, they say those are the most problematic areas to actually treat and get the wounds to heal just because there's so much disruption every time a pet moves. But with Fovea, the benefit is that, again, it brings in that balanced wound healing so that even if there is movement there, you're not going to see disruption of that wound.
my experience is that Fovea works really very well in wounds that are not healing by other means. So decubital wounds, or wounds that are traumatized by the animal, like acrylic granuloma, for example. These wounds that are healing very slowly or not healing at all. So that would be my very first choice for using Fovea, because it will accelerate the healing, and you will really see a different speed of healing in this case when you use Fovea. You see the difference.
Potentially, Fovea can be used in every type of wounds. I mean, wounds, fresh wounds, for example, surgical wounds. If I have some residual gel in the fridge, I use this gel in the fresh wounds before the dog become awake from the anesthesia to reduce the inflammation, the pruritus, and the use of antibiotics in the postoperative period. And we can use Fovea in contaminated wounds because of its effects. We can use Fovea in wounds with a very huge loss of substance, because you know that Fovea enhance a normal healing process, and once you apply Fovea, you can directly see that the skin regrows from the bottom to the top and from the periphery to the middle. And for example, but not only in pets, I love to use Fovea in wounds in horses, for example, or other type of animals.
For wound healing, Fovea actually provides a balanced healing or balanced collagen formation. So we see the normal collagen coming in to kind of replace what's been deficient, and then there's a remodeling that occurs, and this balanced collagen or balanced wound healing actually gives you tissue that's better than a scar that you would have in a normal situation where the body's trying to heal itself. It's actually coming back to what the body already started off with at the beginning.
I started using Fovea many years ago, mainly in deep pyoderma and pododermatitis in dogs. And then we moved from there to superficial disease, such as bacterial folliculitis, hot spots, wounds. I use Fovea in every type of wounds, especially fresh surgical wounds, to prevent wasting of residual gel.
I introduced Fovea in general into group of diseases, probably the ones that are mainly characterized for bacterial skin infection. And so I use Fovea to treat the bacterial disease, usually due to Staphylococcus, or most of the time due to Staphylococcus. And then the second group, I would say that probably in those diseases in which there is a loss of tissue, ulcerative, and in which I want Fovea just to help us in the process of wound healing and cicatrization.
So in my practice, we tend to use Fovea as either a monotherapy, as the only treatment option, or as an adjunct to other treatment options such as systemic antibiotics or topical antibacterial agents. The benefits, especially when we start to look at localized bacterial infections, is that in these areas that have potentially methicillin-resistant organisms that basically evade a lot of the different antibacterial properties, we have an option that doesn't care what kind of resistance pattern there is. It actually kills the bacteria. It breaks down the wall. It doesn't allow the bacteria to survive. It makes the bacteria what's called hyper-susceptible.
Now we are well organized, and we are able to select some days during the week, and we have general nurses that do this for us. So we try to have more than one patient with this treatment the same day, so we can use the best way all the vial that we have without waste part of the gel. And then the best thing that is that if the owner can speak together, they just make a sort of group, and if one is happy of this treatment, the other become happy too.
So what we do is, if we have a case where we think it's interesting, we talk to the owner, and then if we can, we will just do the first treatment right away. If there's a time issue, we will reschedule, and usually we will do the first treatment, the vet and a nurse which has been trained before. If the nurse feels really comfortable, the vet will just be in the same room, maybe printing into the computer, and then the other treatments after that will be done by the nurse. And maybe with every second or third week, we will also schedule a recheck where the vet again looks at the lesion, but he's not present when the fovea is done.
It's not a problem for the animal, just stay 2 minutes, 3 minutes landing on the table, and the sensation of the head is not so difficult to be tolerated by the animals. And we do this together with the owner, so the dog, the cat, quite relaxed during the treatment. We are just talking about something, just to waste time, and just wait the light switch off.
For me, I do practice in the clinic that we do multiple species. So we look at dogs, cats, as well as horses. And then I've also been fortunate to be involved in treatment of some exotic species, such as beluga whales.
Maybe use it for other types of problems like hotspots. These are very frequent, and usually they are very quick to heal, so that gives a lot of satisfaction to the owner and to the vet. And maybe then later on go to more difficult lesions like pododermatitis, where it will take a longer time, like 4 to 6 weeks. Then you have to be more patient, and that maybe he can try in a later stage.
Using fovea, we have now a new opportunity to avoid to use the antibiotics, at least for some specific skin disease as hotspot dermatitis, some skin wounds, and pododermatitis, and some other dermatological problem. But maybe I think I work on small animals, so and dog and cats, but I know the other are going to other species with the same result that we noticed. So I think it will be wonderful going in this way, just to try to avoid to give so many pills to pets.
Since I started to use fovea, I do not rely anymore on antibiotics, for example, for multidrug resistant pyoderma or pododermatitis, or I use fovea instead of antibiotics in superficial bacterial folliculitis, or for the management of chronic and not healing wounds, because fovea has many properties. Not only it enhances the healing process, but it is able to control the bacterial overgrowth, so we can reduce the antibiotics given to our pets. And most importantly, if we use together fovea and antibiotics, for example in deep infection such as deep pyoderma or pododermatitis, we can reduce the length of antimicrobial treatment, preventing the loss of effect of antibiotics and gaining owner compliance.
I use it in a lot of superficial bacterial infections, and there I don't use antibiotics anymore. That's the no. But otherwise I would use antiseptics. But if I use it in deep pyodermas, yes, because for deep pyodermas I would otherwise still use antibiotics, and I actually like to try fovea first before I use antibiotics to see if I need them. So it does reduce my use of antibiotics, yes.
So fovea offers an option to treat locally, not expose the rest of the body of that German Shepherd to immunomodulating drug. And then it also gives us the opportunity to potentially heal those wounds and maybe even stop treatments in the future, not have chronic persisting medications.